just get into our system recently, like in March? No, this is March of
Last year.
2011. Where were you seeing before then?
That's when I came out of the office.
Okay. And your primary care doctor found out about it?
Well, no, actually, I just ended up in the emergency room and
For
they sent
bleeding?
me, yeah.
Okay. Okay, I understand. Okay, you wanna ask me some questions? Some of them we might defer till she gets here, but.
And that's fine. And some of them you've already answered.
Okay.
If she were to have a total mastectomy,
Uh-huh.
what is the recovery time and what is the quality versus,
Lumpectomy.
yeah,
Partial. So it's partial mastectomy versus total, like you said. There's different partial mastectomy,
Right.
same as lumpectomy. Recovery time for both of them, I would say maybe you're a little more sore from the mastectomy than the lumpectomy, but in general you're still sore from an incision. It doesn't go deeper than the breast tissue itself. We don't take any muscle, we don't take anything below that, and you will have a drain in place if you have the mastectomy. If you just have the lumpectomy, we usually don't put a drain in. The drains usually go home with, and that's just because your body will create fluid and it will accumulate in that space, and you want that to drain out instead of accumulating because it can be bothersome and can cause infections and stuff. Drains usually you hang on to them for about a week, depending on how much fluid is produced. The mastectomy, if you just do have a unilateral mastectomy, people do it different. I have to check with her. I don't know what her particular policies are, but sometimes you can go home same day from surgery. Sometimes you'll stay overnight one night. Usually it's just one night, even if you had a bilateral mastectomy. Like I said, you'll be sore. You're going to have somewhat limited arm movement just because we want you to still move your arms, but you'll be sore. Other than that, you'll be up walking around. You'll go home on pain medicine. And the wounds, as long as everything goes straight forward and there's no, problems or complications, will take a couple weeks to heal. You'll feel like yourself and normal again probably in 3 or 4 weeks. Hopefully.
and will there be complications from healing because of the chemo and what she's on?
Sure, there is a possibility, absolutely, because chemo is an immune modulator, basically. It decreases your immune system. I don't particularly expect any direct, definitely this is going to be a problem kind of thing. But yeah, there's a chance that the wounds might take a little bit longer to heal, and you might have more wound problems, complications, things like that. Can't say what chance that is
Right.
or anything, because everybody behaves or responds is a little bit different.
Well, what's the chance of it going into the other breast?
So the risk of getting cancer in the other breast is not necessarily associated with this breast. As long as you're not someone who has a specific gene mutation, it's an independent risk. So it's not, you are like somebody who has had a bunch of family history of breast cancer is at higher risk of breast cancer. Because you have a personal history of breast cancer, obviously, you're at higher risk of getting breast cancer in the other breast than somebody on the street. But at the same time, it does not necessarily mean that you're going to get cancer on the other side. Does that make sense? If that answers.
And how large is the mass?
It's 1.2 centimeters, I believe. Let me just
Okay.
exact. Yeah, 1.2 centimeters.
And if she were to opt for having them both removed, they would do that? Just because of all the other issues at hand?
Sure. You mean, was that an option?
Yes.
I believe so, yeah.
Okay.
I got to check with
Right.
her just to make sure, but I don't see why not.
Okay.
I mean, usually if somebody opts for, even if they don't have all those other issues, if they say, I am terrified of getting breast cancer in the other breast, I don't want to ever have to worry about this again, I want you to just take them both off, we would do it.
Okay, well, that's kind of what I wondered, especially with all the other cancer going on right now.
Yeah.
And it's spreading already.
Sure. Now, I don't think that there's any evidence, well, we're going to feel your lymph nodes and stuff like that. There's no evidence that this cancer has spread to anywhere else yet, but I also don't know yet because we don't know what your lymph nodes are and that kind of thing. So we got to do that assessment, basically. Like I said, that'll be, unless we can feel something today, which usually we can't, then that's not going to be known until we do the surgery and check the lymph nodes.
Okay.
But even if the lymph nodes are involved on that side, that still doesn't necessarily mean that the other side is going to be affected ever. You may never have to worry about it. But
And,
no way
and
to
these are a list of questions from several family members.
okay.
So
Okay.
just so you know. One of them is, if you open up the body to remove cancer, will it spread?
No, and that is very, very common for people to think that. So I don't want you to, you know, but that's absolutely categorically not true.
Okay, you know, you always heard that
Sure.
air, it hits air and then it spreads.
And that is not true at all.
Okay.
Absolutely, definitely no, like, questionable whether it's true. It's definitely not true. What happens, and I think where that has, because lots of people ask me that. What happens a lot of times is we have situations, especially with cancer in the abdomen, of the pancreas, the stomach, all those things. We get a CT scan and we look at it and we say, okay, we think it's here, we think it's confined to this area, we have suspicion, you know, one way or the other or not. We go to do surgery and CT scans are not perfect.
Mm-hmm.
But when we look, we find it actually has spread other places that we just couldn't tell on CT. So that's where that idea comes from, because you got told it hasn't spread yet, or we don't know if it's spread yet, and then you have surgery, and then you get told after surgery, oh, it's everywhere, it turns out. And people kind of associate the two,
Oh,
you know what I
okay.
mean? But it's the surgery did not cause it, it was already like that.
Yeah.
It's just we didn't know until we took a look.
Oh, okay.
Does that make sense?
Yeah.
This is a little bit different. The whether or not it's in your lymph nodes is already present or not.
Yeah.
We just don't know yet. If we feel lymph nodes enlarged, we're more suspicious that there is cancer in those lymph nodes. If we don't feel lymph nodes, that doesn't mean it's not there.
Okay.
So that we won't know until we sample those lymph nodes.
Okay. We know what the prognosis is on the cervical cancer. If she were not to do anything with this, and you just kind of watch it, what would kind of be the outcome? Is her daily life going to go down in quality, having the surgery versus not doing anything at all?
Sure, that's a very good question, and that is something to consider. As far as, you know, your prognosis from the cervical cancer, that's not my area of expertise, so I can't say, but I know he's probably talked to you about that before.
Yeah,
But exactly. But the question still remains exactly how that timeline will go. No one knows. You know, only God knows. Because even with your stage of disease, if we took 50 people with that same stage of disease, there's no way to say you're going to live this long versus this long versus this long. So, you know, especially how well you're going to respond to chemo, how well, you know, your treatment is going to go, that kind of thing. So the breast cancer, yes, we definitely could say we'll leave it alone. We don't need to mess with it because it's not necessarily going to limit your life. On the other hand, breast cancer is relatively easy to treat. Now, if you came in here with pancreatic cancer, the surgery that you need to have for that is extensive and your recovery is long. And I would say there's no benefit to doing that surgery, categorically. That's not worth it because you have other things that are going to probably limit your life potentially before that. It all depends on the specifics. But breast cancer is soft tissue. It has relatively easier surgery. I mean, no surgery is easy, but it's relatively short recovery time. So the only thing I would be concerned about is if you did choose not to treat it, is that it could become something that could become bothersome to you, depending on the rate of growth of the tumor. But it's very hard to say. You might also never notice anything. So that's something to think about. But
well, my way of thinking is I'm battling this cervical cancer. I know I'm not going to get rid of it. But I'm not ready to give up on life either.
Exactly.
I would rather have both taken off and I don't have to worry about it.
I think it's a very reasonable choice. If you came in here and said to me, I just don't want surgery, I don't care, I will avoid it at all costs, then I would say, okay, I think that's not the worst decision in the world. But if you're willing to have surgery, I think it's very reasonable. Just go ahead and do it. I mean, that's what I would do, if that makes sense. Because it's not, like I said, it's not that hard to recover from breast cancer or from breast surgery.
Okay.
And I think
And would they do, say, I chose to have both taken off, they do it at the same time?
Yes.
Or?
Yes. And there's also reconstruction options too that you could consider, but that's another discussion too.
At this point, I don't even, that would be the
Okay.
last thing,
Okay,
you know.
that's low on your priority list.
Yeah.
Understand. That's okay.
Just living is what
Absolutely.
I want, you know.
Yeah.
Is there anything else you can think of?
Well, I think we have everything.
Okay.
I think because me, her husband, my sister, and her brother
Yeah.
kind of all sat down and wrote
Yeah.
several.
I'm glad you did. That's good.
Because otherwise we'd come in here and our mind would go blank.
Exactly. And you know, they say that you only absorb like 20% of what I say the first time. So.
Like the
It takes
name
a
of
long-
what they call it, I want you to
Oh,
write
I
it
didn't know
down for me.
that.
It's okay. It's just so when we go home, we know.
Yeah.
Because we're gonna forget,
Sure.
Mhm.
Understand?
and I'm the one that has to take notes all the time.
She's my personal secretary.
Good. It's good to have one of those.
So,
Too bad she don't get paid for it.
you know, it's just easier to do it this way than, you know, to record it, and then they
Understand.
can go back and listen to it.
Great.
And
Can you write the name of that down, of what it's called?
Of what kind of cancer?
Yes.
Sure. Definitely.
you said it was 1.2?
1.2.
Okay. And so we're waiting on another doctor to come in now?
Yes. So my boss, the attending, the surgeon, she's gonna be waiting. I'm just gonna talk to her right now. She's waiting for me to come out.
And then we'll talk about surgery
And then
options?
We'll make a plan. Yep.
Woo!
We should be able to sign you up for surgery today.
Now, how long does surgery usually take?
It depends on what we do, if we do both or if we do just the lumpectomy, what we do with the lymph nodes, that kind of thing. But probably, kind of depends if we do both sides or just one. 2 hours to 3 hours.
Oh, okay.
1 to 3 hours.
That's not too bad.
Mm-mm.
Not real long. Do you mind if I examine you really quick before I go talk to her?
Okay.
Just want to kind of. Can you feel the mass?
No.
No. Can you get you some I don't know if we have any. Here we go. Just see if we feel anything in those lymph nodes and stuff.
No fair, she gets to take a nap.
I'm gonna slip this arm out, okay? This is right where they did the biopsy, huh? What, right there? Okay. I'm gonna have a picture of it and see if we feel anything.
Okay.
Alright. I'm good. You can sit up if you want, and if you want to sit back over there, that's fine too. Then we go get her and we'll come back.
Does she need to stay naked?
She'll want to feel too, so if you just keep the gown on, I can tie it up for you.
No, I'm fine.
Okay.
Some freezing. I forgot my sweater.
We'll tie you up.
We just need to carry you a Snuggie everywhere.
I know.
Have you lost a lot of weight with chemo and everything?
I got down to 100, so it was actually probably about 57 pounds I lost.
Oh.
And I've gained back 29, I think.
That's good. That's good. Okay, I'll be right back.